Greetings, doctor. My name is Yana Srialdichan with the last three-digit number 119. Today we're going to present our student project in the growth and development block named Frailty and Traveling Vaccination in the Elderly. Here is the list of our members.
Kevin, and my last digit is 105. The aging process is an inevitable process that affects the physiological system in the body and usually occurs in elderly. In 2023, one out of 6 people in the world are predicted to age around 60 years and over, and this population is predicted to rise to 1.1 billion by 2050. This growth of population has become one of the serious problems due to aging, which can lead to frailty and other negative results such as hospitalism, falls and fracture, extensive care need, and early mortality. To countermeasure the infection, vaccination is the most effective way to countermeasure the infection, especially when entering a new environment. Pre-traveling vaccination must be done due to elderly people having lower quantities and shorter duration antibodies. Information. First, what is frailty? Second, how does frailty impact on elderly? Third, what is a traveling vaccination? Fourth, how does traveling vaccination impact on elderly? Fifth, what type of traveling vaccination for elderly?
Okay, thank you for the opportunity. My name is Frailty Jaya with Freelance Kit of the Members 116. The purpose of this project, we have general purpose and specific purpose. The general purpose of this project is aimed to have a comprehensive understanding of frailty and traveling vaccination in elderly. And the specific purpose was to provide a deeper understanding about the frailty and traveling vaccination in elderly. Second, to provide a fresher understanding of traveling frailty in the elderly. And then to understand about the vaccination for frail elderly during traveling. Benefit. We have theoretical benefit and practical benefit. The theoretical benefit of this paper is written to hope that it can enrich the knowledge about the frailty in elderly and the vaccination for frail elderly during traveling. In addition, this paper is expected to be a good reference for future research and future studies on the topic. And the practical benefit, we hope that the paper can give many information about frailty elderly, especially about its definition, factor, and impacts on the health. Not only that, this paper is expected to provide information about vaccination for frail elderly during traveling. Thank you.
My name is Natasha Pramatia Putri with Trila student number 111. I'm going to tell you about the general information of frailty. Frailty is a condition that is related to aging and detrimental to health because it leads to a reduction of physical, psychological, and social function. The prevalence is high in old age and causes falls, disability, hospitalization, and mortality. According to one of frailty studies in Indonesia, the prevalence in 2019 was 25.2%. This number was related with age, functional status, and nutritional status. According to Frey, this condition fulfills 3 out of 5 phenotype criteria that indicate compromised energetics, such as low grip strength, low energy, slow walking speed, low physical activity, and unintentional weight loss. On the other hand, risk index of frailty, called frailty index, has been determined by counting the indicators that accumulated over time, including disabilities, disease, physical and cognitive impairments, psychosocial risk factors, and geriatric syndrome.
Greetings, Doctor. My name is Gabriela with student numbers 118, and today I'll be explaining about factors influencing frailty. There are 5 factors that influence frailty, which are first, physiological changes. Aging is associated with a gradual decline in physiological function. Second, psychological changes. While as people age, they tend to experience a condition called late-life depression. Third, increased risk of chronic medical conditions such as heart disease, diabetes, and cancer. Fourth, social changes. While elderly, they may experience social changes such as retirement and loss of friends and family, and less increased likelihood of medication use because elderly, they tend to use multiple medications, which can interact with each other and contribute to frailty. I think that would be all for me. Thank you.
Okay, so my name is Faruza Husni Adiba with 3 last digit of student number 102. So I'm gonna explain about the impact of frailty on the health of the elderly. So next. Okay, so first of all, frailty is a condition wherein there's decrease in the physiological reserve, and the decreases also happen in the capacity of our body to maintain the homeostasis, and this will increase the susceptibility to the disease because the body become more vulnerable to the external or internal stressor. So this can lead to bone fractures, disability, falls, hospitalization, worsening mobility, and dementia. And the diseases that associate with this frailty can be very. The first one was coronary disease, and then aortic stenosis, cancer, abdominal disease, cirrhosis, chronic kidney disease, advanced heart failure, and the last one was critical illness. And all of this will result in the prolonged healthcare, and it can lead to the lessening of quality of life. That's all from me. Thank you. Next.
Let me introduce myself. My name is Ida Bagus Tresna Indra Putra Pramana with the last three-digit number 104. So travelers run the danger of being exposed to infectious pathogens which they are not resistant. Exposure risk varies greatly between places, often higher in impoverished nations with varied prevalent infectious illness severity. Therefore, global health agencies make advice for preventative measures to take before going to specific parts of the world, such as immunization against vaccine-preventable infectious illnesses. It is also important to pay attention to the physiological changes, immune responses, and comorbidities correlated with the process of aging in elderlies. Travel vaccinations are defined as immunizations that are prescribed for travelers for any reason to an international destination as part of their pre-travel preparation.
Greetings and allow me to introduce myself. My name is Tracy Odaljiralia Keme with last digit NIM number 115. The importance of vaccination before traveling for frail elderly. Vaccination is essential for everyone of all ages, but especially for elderlies. Two main factors that are responsible for the poor response of vaccination in elderlies are the immunosenescence, which is the worsening of physiological function, and the body becomes more affected by the external stressors. Next is the increase of pro-inflammatory status. Traveling abroad increases the risk of getting infections and diseases. As travel among elderlies is becoming common, there needs to be an increase in providing pre-travel health consultations and recommending vaccines that are required in the destination that travelers are planning to visit. It is also important to pay attention to the physiological changes, immune responses, and comorbidities correlated with the process of aging in elderlies.
Let me introduce myself. My name is Samantha Petrona Theobald with NIM 220251108. There are a few types of vaccine which are recommended for frail elderly before traveling. First, influenza. Influenza in travelers can be prevented by vaccination. Due to decrease in immunity response and frailty, efficacy of vaccination on elderly has a lower response compared to adult vaccination. Trivalent inactivated high-dose vaccine, quadrivalent inactivated adjuvanted vaccine, and quadrivalent recombinant vaccine are the examples. Second, pneumococcal vaccine is used to prevent Streptococcus pneumoniae disease. Pneumococcal vaccine is especially important for elderly travelers who travel with high transmission potential vehicles, such as planes, ships, and buses. Third, yellow fever. Yellow fever vaccination is used to prevent the yellow fever disease. There are few countries that are required visitors to be vaccinated. Yellow fever vaccine is recommended only for travelers who going to high-risk area. Fourth, hepatitis. The purpose of hepatitis vaccination is to prevent hepatitis A and B virus disease. Hepatitis A is a common travel disease which can infect a variety of the age. Due to high risk of infection, hepatitis vaccination is highly recommended for travelers. Some research has proved that hepatitis A vaccination is a cure for older travelers. Some travel destinations also found to be endemic for hepatitis B. The combination of both hepatitis vaccine is recommended for high-risk travelers. The vaccination is also recommended for travelers with comorbidity.
Hi, my name is Neta with the last three digit of student number 112. So cholera is a disease caused by the bacterium Vibrio cholerae. The characteristic of cholera is mild to potentially fatal acute watery diarrhea disease and is spread through the fecal oral route. There are currently two types of oral cholera vaccine available internationally, which are WCRBS and WC. The recommended dosage for adult and elderly is 100 milliliter as a single dose, a minimum of 10 days before potential exposure to cholera or before traveling. The next one is typhoid fever. which is a systemic infectious disease and bacterial infection caused by the gram-negative bacterium Salmonella typhi. The main characteristic of typhoid fever is high fever and is spread through the fecal-oral route. There are two typhoid vaccines that are widely available, which are Vivatif and Thifim V, and also the two newer vaccines, which are type bar and pedotype. So the next one is invasive meningococcal disease or IMD, which is a disease caused by the bacterium Neisseria meningitis. There are three different quadrivalent conjugate vaccines that are widely available, which are Manactra, Nimanrix, and Menveo. Elderlies have to be vaccinated with 2 doses, 8 weeks apart, and a booster should be done and should be applied when a previous vaccination was performed more than a year ago.
Hello, my name is Bernard Kalkores Mafati, with the last digit of master number is 103. There's another recommended vaccine for frail elderly who wanted to travel is rabies vaccine, which is, we all know that rabies is a disease that particularly deadly, and if it's not treated quickly, it can lead to death. That's why the World Health Organization recommends that travel who may be exposed to rabies such as fever get vaccinated beforehand. And there's another recommended vaccine is vaccine for Japanese encephalitis. The WHO suggests that those planning to stay in areas with the disease is endemic for more than a month or engage in outdoor activities during the epidemic season get vaccinated. And there's another vaccine is vaccine for dengue fever, which the WHO recommend that those traveling to endemic areas for this dengue fever takes precaution against mosquitoes bites and consider getting the dengue vaccine if they have a history of dengue infection. Thank you. I will talk about the effectiveness and safety of vaccine for elderly. A study shows that vaccines are safe and effective for frail elderly. A study found that the high-dose vaccine was more effective than the standard dose vaccine in preventing hospitalization due to influenza in older adults. The subunit herpes zoster vaccine is highly effective in preventing chickenpox and postherpetic neuralgia in elder adults, even in people with weakened immune system. Recent studies have shown that COVID-19 vaccines are highly effective in preventing COVID-19 infection, hospitalization, and death in older people. And pneumococcal vaccines are effective in preventing pneumococcal disease and reducing the risk of hospitalization in elder people. So vaccination is essential to protect elder adults, all elderly, from serious infection and complication. That's all from me. Thank you.
Alright, so hello, my name is Justin Kinarata Santosa with student number 2202511106, and I will be the one bringing you to the conclusion. Alright, so in conclusion, frailty is an inevitable condition that all people will go through, and it's linked to aging. It leads to a decrease in physiological, psychological, and social functions. Well, there are several factors that affect frailty, such as psychological changes, physiological changes, increased risk of chronic medical conditions, social changes, and increased likelihood of dependency on medicine. And traveling vaccination is a preventative measure advised by global health agencies before traveling to various parts of the world. And there are immunizations prescribed for travelers to prevent vaccine-preventable diseases. And traveling vaccination is important in elderlies, especially due to their bodies not functioning at their peak anymore, due to something called immunosenescence and increase of pro-inflammatory status. So that's all for me. Thank you.
So that concludes our presentation. Thank you for your attention.